Is a digital rectal exam necessary for prostate screening? Is a digital rectal exam necessary for prostate screening? This is a question many men may ask as they approach screening for prostate cancer. The digital rectal exam, or DRE, has been a traditional part of prostate cancer screening, but its necessity is being reevaluated. Let's explore this topic in detail. The DRE involves a healthcare provider feeling the back part of the prostate through the rectum to check for lumps or abnormalities. However, it's important to note that this exam only assesses the posterior surface of the prostate. It cannot detect issues in other parts of the gland. Research has shown that the DRE alone is not very effective as a screening tool for prostate cancer. In fact, studies indicate that it does not significantly improve detection rates when used alongside the prostate-specific antigen blood test, commonly known as the PSA test. Because of this, many experts believe that the DRE is not a useful standalone screening method for prostate cancer. Currently, the PSA blood test is the primary recommended method for screening. Elevated PSA levels can indicate the need for further evaluation, but they are not definitive for cancer. Recent guidelines suggest using multi-parametric magnetic resonance imaging, or mpMRI, as a first-line investigation after an elevated PSA or if there is clinical suspicion. This imaging method can detect prostate abnormalities more comprehensively than a DRE and can help avoid unnecessary biopsies. The mpMRI has a high negative predictive value, meaning that a negative result can safely reduce the need for a biopsy. Leading urological associations recommend the PSA test as the initial screening method. While the DRE may still be used alongside the PSA test to help assess risk, its role is becoming less emphasized. Shared decision-making between the clinician and patient is encouraged, taking into account individual risk factors and preferences. In settings where mpMRI is available, routine DRE may not be necessary. Despite its limitations, the DRE can still detect some cancers that might be missed by PSA testing alone. However, it can cause discomfort or embarrassment for some individuals. The DRE is a quick and low-cost exam that can be part of a prostate evaluation, especially in places where advanced imaging is not accessible. Nevertheless, it should not be relied upon as the sole method for screening. In summary, while the PSA blood test is the cornerstone of prostate cancer screening, and mpMRI is increasingly used for further testing after elevated PSA levels, the DRE has limited sensitivity. It is not routinely necessary where imaging is available. However, it may still be used in conjunction with PSA testing based on clinical judgment and patient preference. Personalized medical advice from a healthcare professional is essential to determine the most appropriate screening approach for each individual.